Hey guys, I just wanted to hop on and talk about something that has been really sitting on my chest because I have been reaching out to quite a few ladies in this TTC community, and from my experience with IVF, doing it for a year, this is the number one suggestion that I can give anybody, and that suggestion is to freeze your eggs. Do not make the mistake I did and not freeze your eggs. If you get a retrieval and they take 10 eggs out, tell them you go freeze. Pay that $1,800, pay that $2,000, pay whatever it costs to freeze them eggs. It's a chance that all 10 not gonna make it. But even if you got one egg to freeze, pay for it to go in that freezer, because studies show and statistics has proven that frozen IVF cycles end with positive pregnancies 10 times more than fresh cycles. And when I say fresh cycles, I mean they take your eggs, they fertilize them, a couple of days later they pop them back in. With a frozen cycle, they take your eggs, they fertilize them, boom, they go in the freezer for a minute, and then they come out and then they transfer them. I don't know what exactly the freezing part does, but I do know that more women are successful with frozen cycles than fresh cycles. And I wanted to hop on here and talk about that because I've been watching a lot of videos, and I've seen one woman say she has set her mind up to do 2 retrievals and 1 transfer. And one lady says she set her mind up to do no more than 4 retrievals and 2 transfers. Do 1 egg retrieval. Freeze whatever eggs you have. That way, if your first transfer don't work and you still got eggs in the freezer, they could just go in there, throw them out, pop that one in there. You have a higher chance of having a pregnancy test. Our first cycle was our best cycle. I'm so sad that donor is not available anymore. Was our best cycle. We retrieved 10 eggs. Out of the 10 eggs, 3 made it to blastocyst stage. We decided to transfer 2. We didn't necessarily was doing that with the intentions of having twins or triplets or any of that, because I'm terrified of that. I'm terrified. Listen, I'm a thick girl. I'm tall. I'm 5'9½". But everything down there is premature. So multiple babies, that terrorizes me. So we was really transferring 2 with the hopes of just 1 sticking. And we had 1 egg left, and the doctor asked if we wanted to freeze. He was so positive that we was going to get pregnant, and him being so positive made us positive that we just felt like we did not want to spend $1,800 on just 1 egg. And that's the biggest regret I have, because had we froze that egg, I probably would have given birth a few months ago, honestly. We didn't freeze anything. It did not work. We moved on to the second one. That round, all of the eggs was some trash. None of it worked. Couldn't freeze anything because none of them survived. They didn't even make it to the blastocyst stage. The last cycle we transferred 2, and we agreed to put the remaining 1 in the freezer, but a couple of days after our transfer, we were called and informed that it didn't make it. You know, and that's one of the biggest regrets I have. So if you do anything during your cycle, freeze your eggs. And I know it's a lot of people that's going to say, oh, freezing, that's an extra expense. That's an extra $1,500. That's an extra $1,200. That's an extra $1,800. That's an extra $2,000. Depending on who is your clinic, you know, it's going to be extra cost. But the way I feel about it is, and I'm not trying to shade anybody, I'm not trying to make anybody feel bad or anything like that, but If you have that many complaints about the cost of this process and the cost that of freezing and the cost of just adding one more thing to the already long list, how in the world are you going to be a parent? And that's no shade. Having kids is expensive. I guarantee you would spend more money on that child the first year than you will this entire TTC journey, just off of daycare alone. And God forbid you had two, so your daycare bill just doubled. So you went from doing $300 a week to now doing $600 a week, depending on where you live. Daycare is very costly. Here in Baltimore and the DC area, having a daycare center is a big business. I know daycare owners that's driving 2019 Mercedes trucks, because it's so expensive. So if you are not comfortable taking that one extra step, you really need to stop, maybe save up some more money before you think about doing this. And I'm not trying to be mean, I'm not trying to be cruel, but kids are expensive. A lot of times people have this assumption that kids are like accessories. They like doll babies. Oh, I'm just going to have her look cute and this, that, and the other. No, that cuteness comes with a cost. You have to pay for milk. And a lot of people say, oh, I'm just going to breastfeed. Sometimes breastfeeding don't work. Sometimes the babies don't latch. Sometimes you don't produce enough milk. Have you prepared yourself for that? Have you thought about that? Have you considered that? Have you factored in the cost of milk if your breasts don't work? I have a relative whose child was premature, and since she was premature, she had to have a special type of milk. Not just regular baby milk, but it was I don't even remember the name of it, but each can that was like this big was $150 a can. And what else you gonna do? You gonna have to pay for it. You know, you have to prepare yourself for those things. So I know it can be expensive. I know it's a lot, especially if you only have one egg. That's something that my spouse and I, we couldn't get with the first time. We was just like, we don't want to spend that for just one. And now I'm kicking myself because we didn't. I'm kicking myself. And I know a lot of women, they just be like, oh, I'll just have multiple egg retrievals. Egg retrievals are hard. It's not, I don't know what some people think or why they think this is such an easy process. Like you just lay down and they take them out and you go on about your day the next day like nothing happened. And that's not how it works. With IVF, the injections does a lot to your body. It's going to drain you. Sometimes they make you tired. You're injecting steroids in your body. So it's a chance that you will gain weight while you on injections. For those little old 2 weeks, you have the possibility of gaining up to 15 pounds just off the injection. Okay? You stick the needle in there, you're getting used to it after the first day. You're like, okay, I could do this. And you just sticking the needle in your stomach. And then like a day or two before your transfer, you're going to start to feel that the medicine worked. Because now your eggs are big and they're heavy and you feel comfortable. You feel like almost like your tube and your ovary is hanging and just dangling on the inside. You just feel so weird. It's hard to describe and it's very painful. It's like I don't want to say I was in excruciating pain, but I was very uncomfortable. And when they take it out, some women don't feel nothing at all. Some women don't even have to take their medication after they have an egg retrieval. Some women feel like they just had their menstrual cycle. Some women, like me, after my first egg retrieval, I became very constipated, and that's common. And to be constipated and just had your eggs removed, girl, I was in some type of pain. I mean, childbirth felt better than the pain that I was in. I cried just to go to the bathroom to urinate. Just to walk from my bed to the bathroom that was next right there. It was like literally right there. Was painful. You know, it's a lot. So if you have one retrieval and they take 10 eggs and 7 of them make it to blastocyst stage, girl, you don't have to pay $2,000 per egg. You just paying that to freeze them. To freeze however many you have, freeze them. It's a hell of a lot easier to just freeze your eggs than to have to do egg retrieval after egg retrieval after egg retrieval. It wears your body out. I am a strong advocate based off of my mistake. Freeze your egg. That way, if you have more than one eggs frozen and the first one don't work, you can go back in there and you got a second chance. You got a third chance. You got a fourth chance. But if you don't freeze at all, you're going to have to keep doing the retrievals back to back to back to back to back to back. Why would you want to do that to your body? Don't force yourself to have to stay on injections longer than you need to. And I know it's hard, and I'm not trying to be mean to anybody. I don't want anybody to take it the wrong way, but IVF is really difficult. And a lot of the medications that you're on is going to bring up emotions that you try to keep in. You're going to be scared. You're going to question everything. You're going to question yourself. You're going to question God. You're going to ask the universe why. You're going to, without even trying, you're going to devalue yourself because you're going to instantly feel like I'm a woman. I'm supposed to be able to give birth. I'm supposed to be able to reproduce. I'm supposed to be able to do this. And for whatever reason, I can't do it. Something's wrong with me. You feel like you're walking in a room full of beautiful people, and here you are with Band-Aids all over your body. That's how you feel. All of that is normal, and it's okay. Do not force yourself to have to go through those things more than you need to. If you get pregnant, it's totally worth it. But if you don't you think it'll be a hell of a lot better to have a plan B than just completed A and don't have no other options? Don't be me. Here it is, September 2018. And with my next period, I will be starting my day 2 blood work all over again and most likely starting a new IVF cycle in November. And I'm starting completely over. I have no eggs at all. If you count the eggs I had from my first cycle and my third cycle, I should have at least 5 eggs in the freezer, and I have none. So I have to start completely over again. I have to start from scratch with the birth control. I have to start from scratch with the injections. I have to start from scratch with the progesterone. Like, the side effects are real. It's real. If you have the means to freeze, freeze. If you don't have the means, still go through with it. Still go through your journey. And just pray that everything works out. And for most of us, it does. I mean, I have a fertility IG now that I started and a fertility blog that I started. And even though I'm going through my struggles with fertility, it makes my heart smile so hard when I see women that has gone through this just like I have get their positives. And then they get their beta numbers. And then they get they next day beta numbers. And they just keep going up and going up and going up. I'm not saying don't do it. Definitely do it. But if you have the means to, do not be an idiot like I was. Freeze your eggs. Freeze your eggs. Bye, guys.